Hello everyone, my name is Jackie. So today I am going to present my research paper titled The Risk of Malnutrition is Common in Patients with Coronavirus Disease 2019, COVID-19 in Wuhan, China, and it's a cross-sectional study. So a little bit of introduction of this paper. Obviously, it's all based on coronavirus disease 2019, COVID-19, and it is a severe acute respiratory syndrome, and the main symptom is respiratory tract infection, which patient can experience fever, cough, and in some critical cases, patient might have organ damages in liver, heart, or kidney, and it can also lead to organ failure and death. Among patients who are infected with COVID-19, they might also experience decreased food intake due to loss of appetite and serious symptoms, which can increase the risk of malnutrition. And there is a recent cross-sectional study in 182 elderly COVID-19 patients, and the study reported malnutrition. It's taken 52.7% of total population in the study, and the malnutrition risk is 27.5%. However, there's no reported in nutritional status of COVID-19 patients in different age group, and there's no known the clinical relevance of nutritional status of patients with COVID-19 and the prevalence of malnutrition. So here we go. The objective of this research paper is to evaluate the nutritional status of COVID-19 patients and to identify factors independently associated with malnutrition risk. This paper is retrospectively evaluated the nutritional status of hospitalized COVID-19 patients and identified the independent factors with malnutrition risk in patients infected of SARS-CoV-2. So we will jump to the methods of this paper, and I have three parts of underneath. So first of all, I am going to talk about the study design and participant selection in this paper. It is a single-center cross-sectional study, and we have total 760 adults COVID-19 patients who admitted to the hospital from January 29, 2020 to March 15, 2020. And the exclusion in this patient are patients who have incomplete medical records, who are pregnant, who has obnubilation or with linguistic difficulties, patients who have incomplete questionnaire, or who have severe hepatic or renal dysfunction. So the diagnostic criteria of this study is based on China's National Health Commission, which patients should have a history of epidemiological exposure to the virus, have clinical symptoms such as fatigue, fever, muscle soreness, headache, or diarrhea. And patients should have either normal or decreased amount of white blood cells. In patients' chest CT, they should have a multiple patchy shadows findings, and patients should have a positive detection from PCR, which means they have infection of coronavirus. So the data collection of this study is based on patient characteristics and laboratory data. So for patient characteristics are age, gender, symptoms, BMI, comorbidities, disease severity, and clinical outcomes. And then we have the laboratory data, which are the most valuable data that link to the study results. So first of all, we have the serum albumin concentration, which the normal range is 35 to 55 gram per liter. Pre-albumin concentration, the range of 150 to 400 milligram per liter. Then we have a Barthel score, which is the score system used to assess the performance in activities of daily living, which range from 0 to 100. So we can know that 100 as a normal range, normal score, normal as normal, 61 to 99 as mild impairment of the activity of daily living, 41 to 60 as moderate impairment, and lastly we have less than or equal to 40 as a severe impairment in the activities of daily living. Next, we have the nutrition risk screening and RS, which is used to assess the risk of malnutrition. And the malnutrition risk was defined as a score of greater than or equal to 3. Lastly, we have the COVID-19 case classification, which are mild, moderate, severe, or critical. However, in this case, the paper did not include a mild cases. Okay, so we are going to talk about the results of this paper. So based on the patient characteristics, we have 760 of 803 COVID-19 patients that fulfill in the inclusion criteria. And then the gender ratio is 1:1. Median age was 60 years old, and the median BMI was 24. And then we have found that the median serum albumin concentration was lower than that at the physiological level, which we have 50.3% of total population have a low albumin concentration, which is less than 35 gram per liter. The median serum pre-albumin concentration was within the physiology range, which we found that there was only 25.5% of patients who have the low pre-albumin concentration, which is less than 150 milligram per liter. Like I said, there is no mild COVID-19 cases in this study. And then we also found out that the median Barthel ADL score indicated slightly impairment of daily activity among these patients, which 45.1% of patients have a score of 100, 37.6% have 61 to 99 score, 10.4% have 41 to 60. And then we have lastly 6.84% have the score lower or equal to 40. I forgot to mention that there's no mild COVID-19 patient in this study, but to mention the moderate cases are 10%, 74.7% are severe, and critical is taken 15.3%. So the clinical variables, like I mentioned before, the criteria is included the nutrition risk score, which the normal nutrition score should be less than 3, and risk of malnutrition risk score is larger or equal to 3. And in this study, we have 82.6% of patients have the score larger or equal to 3. And we also found out that the median age of patients in risk of malnutrition group was significantly higher than in the normal nutrition group. And then the median BMI in the risk group was significantly lower than in the normal group. The median ADL, the Barthel score, in the risk group was also lower than in the normal group. However, there's no significant differences in gender between two groups. There is no significant differences in symptoms, but fever was the only symptom with significantly different frequency between the groups. And there is no significant differences in comorbidities. And however, we found out that patient, like I mentioned, there's a median age, it's significantly higher in risk of malnutrition group, which means patient who is older or equal to 65 have higher risk of malnutrition in this study. And malnutrition risk frequency were found to be significantly different in the stratification of albumin concentration, pre-albumin, and clinical outcomes, which were associated with the disease severity and different function performance in the activity of daily living. And lastly, the differences in malnutrition frequency in the different BMI group was not significant. So we found that the risk of malnutrition in older patients was 5.4 times higher than patients who are younger than 65 years old. And critical ill COVID-19 patients had 4.46 times higher risk of malnutrition than patients with moderate COVID-19 cases. And the risk of malnutrition in patients with a low ADL score was 4.5 times higher than who have higher score, which means patients who have a score as 60 have a higher risk of malnutrition than who have a score of 100. And then patients with albumin concentration less than 35 grams per liter have 3.61 times higher risk of malnutrition, and patients with a pre-albumin concentration less than 150 milligram per liter had 2.88 times higher risk of malnutrition. And then as I mentioned before, fever, BMI, and clinical outcomes did not show a significant link with the risk of malnutrition in patients with COVID-19. So in this slide, I'm going to talk about the discussion and conclusion of this paper. So as the researchers state, malnutrition could be a result of infection, and symptoms of COVID-19 affect energy consumption, appetite, and nutrient absorption. And then psychological stress are presented as depression and anxiety, which potentially can impact the dietary behavior, such as appetite and also absorption, in my opinion. So nutritional support should be strengthened for patients who have COVID-19, especially elderly, critical ill patients, and those with poor ADL functions and low albumin or prealbumin concentration, which may improve the clinical outcomes. And then, like I said, older age has a higher risk of malnutrition due to loss of skeletal muscle mass and function, oral and chewing problems, psychosocial issues, cognitive impairment, and low financial incomes. So these all factors can affect the risk of malnutrition, like can impact their nutritional status and their nutritional assets that can lead to higher risk of malnutrition. And then lastly, we conclude that the serum albumin and prealbumin, older age, case severity, and ADL functions are indicators for assessing the risk of malnutrition. One thing to mention that the low serum albumin concentration can are caused by decreased protein intake and the increased body need of the body because of the quickly breakdown of protein when have infected of the virus. And then these findings suggest that the maintaining a normal albumin and prealbumin may prevent the risk of malnutrition. Okay, so let's talk about the limitations of this study. So this is a cross-sectional study, and it is a single-center study, which the hospital was designated for severe and critical COVID-19 patients, which there's no mild COVID-19 cases in this study, which can lead to bias because mild cases are not in the criteria of this study, which it can kind of misunderstand us that mild COVID-19 patients will not develop the risk of malnutrition, which is not true, because everyone have their different symptoms of COVID-19 if they're infected, and everyone's immune system and their nutrient absorption and their body response are different. So I think it can be a bias that if they just take off the Maya cases from the study, and then the association from other aspects such as social support, dietary habits, and mental condition, which can also influence the result. And then subjects who are previously undernourished and were also included, which can lead to the bias because the patient is already undernourished and it doesn't they're already undernourished. So in this case, the relationship between the COVID-19 and the risk of malnutrition can be misleading. And then this is a observational data. So the data are all from observations. So it can have any causal relationship that we can find. So I have my own little personal thought about this paper. I think this is a very easy to understand paper and study, and it clear out the association in a specific population who the patients are from moderate to critical COVID-19 cases, so we can clearly find out the outcomes of the nutritional status of this patient, which we can find out that patient with critical cases have higher risk of malnutrition. And then the cross-sectional is beneficial for evaluating the exposure and outcome. Like I said, the outcome is patient's nutritional status, and the exposure is patients who are infected with the COVID-19. And it really provide a clear association among the subjects, which how COVID-19 severity impacts participant or patient's nutritional status. And this paper does not include a lot of citation or a lot of different paper reviews. However, it includes several review papers, some other cross-sectional studies and guidelines to provide some evidence and some information to support some definition or indications in this study. And this study is mostly based on the data or medical history and the laboratory value from patient documentation. So I think they are pretty valuable. And I want to add some my personal thoughts about reading. After reading this paper, I think that for patients who are infected of COVID-19, that to assess or prevent further malnutrition, it's important to monitor patients' muscle, subcutaneous fat loss to prevent or to decrease the risk of malnutrition. And then early nutrition support can be beneficial because, like I said, the body is breaking down their protein quickly, so the protein need and energy consumption is increased, which we need to have a early nutrition support to kind of help them out with the risk of malnutrition. And overall, I think this study demonstrates a viewpoint of nutritional status on a clinical view of COVID-19 patients. And I enjoy reading this paper because I kind of learn a lot from it. Yeah, that's it. Thank you.